Now, it's my pleasure to introduce Deanna Bonta. She is from Kaiser Permanente, where the healthcare system meets the health and vitality of communities. Dr. Bonta is Kaiser's Vice President of Public Affairs in Southern California. She leads the organization's community benefits programs that devoted over $600 million in 2010 to improve the health of our local communities. Prior to joining Kaiser in 2004, she served as Director of Health Services for the state of California, as well as Director of Health and Human Services for Long Beach, California. She was selected as one of Hispanic Business Magazine's Outstanding Women for 2008, and we're so happy to have you, Dr. Bonta.
Good morning, everyone, and welcome. I think this is a first for me. It's the first time that I've actually addressed a group of percussionist musicians. I think what it prompts me to say is, may the force be with you. I'm very pleased to represent Kaiser Permanente's sponsorship and leadership at this Childhood Obesity Conference. And I'm joined today by talented and dedicated colleagues. In fact, there are 80 individuals from Kaiser Permanente in the audience this morning. Many of you have met Dr. Michael Moreno, who has initiated behavioral changes with his Walk with Your Doc program. Research has shown that health action or changes in health behavior are motivated by 3 factors. And the first is life moments, like when you turn 50. The second is support of a loved one. Those can make changes in your life when they plead with you and ask you and tell you that it's important to them. And the third is information motivators. The factors are enhanced if multiplied by a public engagement factor that allows people to participate, to create, to socialize, to advocate, and to partner. Well, obesity in the United States now carries the hefty price tag of $147 billion per year in direct medical costs, just over 9% of all medical spending. And by 2018, current projections indicate that those costs will more than double to nearly $350 billion with a B and consume 1/5 of healthcare dollars. We certainly have seen that people who are obese, that their spending for health insurance, for medications and such, increase their individual costs by as much as $1,500 a year and upwards above that. Well, where do some of the costs come from? We've seen it at Kaiser Permanente in an increase in bariatric surgeries, as I know my other healthcare organizations have experienced as well. Our specialty care physicians see their patients deteriorating quality of life that results from a sedentary lifestyle and poor nutrition, especially when it's linked with smoking. We see it in our work and in our society, and with the economic downturn in all parts of the country, at Kaiser we've been looking at ways to help our safety net partners. And one of these opportunities is by providing free surgery days for patients that normally would have had to wait for quite a while through their safety net partnerships to receive the surgeries. These are outpatient, low-risk surgeries that Kaiser is providing, but unfortunately, there are many times when we've had to turn down candidates because they are obese and factors of their weight present a high risk to the surgery as opposed to a lower risk if they had been within a normal weight band. By 2025, a large percentage of overall healthcare costs, at least 20 to 25%, will be obesity related. Well, in Southern California, we had a study of more than 310,000 children and adolescents. These were KP members during 2007 and 2008. And researchers examined the number of patients with extreme obesity, and this is defined as a BMI of over 35. The study demonstrated that 7.3% of boys and 5.5% of girls were extremely obese. translating into more than 45,000 extremely obese children in this cohort. The percentage of extreme obesity peaked at 10 years in boys and at 12 years in girls. The data tells us that the heaviest children were African American teenage girls and Hispanic boys, and the percentage of extreme obesity was lowest in Asian Pacific Islanders and non-Hispanic white children. The older an overweight child is, the more likely he or she will continue to be overweight as an adult. Less than 10% of overweight infants will be overweight as adults, compared to 20% to 80% for adolescents. And you can see then how critical it is for early intervention. So we can prevent overweight children from becoming overweight adolescents, and we can influence their health status later in life. Well, Kaiser Permanente pediatricians counsel families on 0-1-2-5 message, 5 more fruits and vegetables, 2 hours or less of recreational screen time, 1 hour or more of physical activity, 0 sugary drinks. But healthcare providers are just one part of the puzzle. We know that families then leave the examination room and they're faced with the environmental challenges that your speakers have talked about. Let me turn now for a few minutes to healthcare reform and prevention. And you can imagine our excitement when about 2 weeks ago a comprehensive national prevention strategy was announced. And this prevention strategy was called for in the National Healthcare Reform legislation, which was signed into law last year. The strategy is far-reaching and comprehensively approaches prevention and wellness, and it prioritizes the elimination of health disparities. We know that this funding opportunity is a chance to strengthen California's efforts to prevent obesity, to reduce tobacco use, and to address the burden of chronic illness on families and communities as a whole. At Kaiser, we're excited about this funding opportunity, and we're very supportive of public health departments in preparing their proposals by lending some of our clinical protocols and other resources. So, for example, sharing our tobacco cessation resources, our breastfeeding practices, our program dealing with ALL, which is a medication regime to reduce the risk presented for diabetic patients, and our proactive office encounter. We know that community health is more than access to health care. That's why nationally, we've committed more than $50 million to obesity prevention by 2015. Public policy changes are working. We've seen it in Los Angeles Unified School District's banned sodas in 2002, leading to banning junk food and changing menus, and they've just banned chocolate and strawberry milk in the schools. We certainly see it in our Healthy Eating, Active Living, or HEAL program, which promotes the improvements in nutrition and physical activity and reductions in overweight and obesity within a targeted population. We began our community health initiatives in 2006 with 6 HEAL communities in Northern California and Colorado. And today there are more than 30 HEAL collaboratives across California, Colorado, Georgia, Ohio, the Pacific Northwest, and the Washington, D.C. area. So it's spreading. Based on the learnings from 5 years of a Healthy Eating, Active Living, place-based initiative, our Northern California region will be launching up to 7 HEAL zone communities, and each will be receiving about $1 million of funding. Later this year, 3 new HEAL sites in Southern California will be selected to be part of this national effort. Each will focus on a small geographic area and 4 specific goals: to decrease caloric consumption, to increase fresh fruits and vegetable consumption, to increase physical activity, and also to increase physical activity not only in the communities but in institutional settings. I have up here on the screen a good example of our HEAL in Santa Rosa, and you've seen these types of photographs before where the roads weren't there, or there wasn't the ability to have walking paths and well lit and safety in mind for children and adults to walk to school. And because of the work that's been done in Santa Rosa, we see here that where HEAL was able to secure $1 million in state and federal Safe Routes to School grants to make it safer for kids to walk and to bike to school. We were also privy to 2 large Caltrans grants that made it possible to widen those sidewalks as well. Well, we know that tough economic times make it difficult to eat well, and that many people are going without jobs and household incomes have declined, making healthy food choices not at the top of their to-do list. So we're looking at ways through our Healthy Eating in Hard Times program to develop grants to food banks, to food pantries, and to soup kitchens to improve the nutritional quality of the food that they distribute to clients. Yesterday, Dr. Linda Rudolph, Deputy Director at the California Department of Public Health, Center for Chronic Disease Prevention and Promotion, what a long title, introduced you to the Health in All Policies Task Force. A Health in All Policies approach recognizes that health and prevention are impacted by policies that are managed by all government entities, not just those related to health. So, for example, transportation and planning are part of the solutions. And one of the recommendations is identified in this task force report is to leverage government spending to support healthy eating and a sustainable food system. So specifically adopting a healthy food procurement policy to ensure that foods purchased for consumption or sale on state property meet minimum nutritional standards. So we're looking forward to opportunities to partner with the California Department of Public Health, Kaiser Permanente, and the Public Health Institute.